being in, in the heat of the pandemic, I think this was the right solution. And I think that it worked really good in the heat of the pandemic. And I do think moving forward that it's going to have its place, at least in the rural communities. I still put a lot of faith in human interactions. I think that physical therapists need to sit down with kids. The same thing with all of the doctors. I think that there's definitely doctors that need to sit down with their patients. But that's where it's a big issue for the states. It's like, can we bill 100% for this service that we think is better served by the individual being in person with their doctor?
Great
and
point.
It's going to take a little while for those conversations to get had in that type of legislature to go through. But I do know that since we've had the pandemic and people have been forced to do this, those conversations are happening right now as we speak. So that had to happen before we could move forward. And I'm just happy that things are moving forward in that direction, because there are going to be certain communities that were underserved that are going to be served better as a result of this.
I see Patricia's comment here as well about that they're in a high Medicare population and having challenges with technology and such. And we serve folks with age-related disabilities on our waiver. And a lot of our efforts from our team was around, before we have our actual quarterly call with you to do your plan of care, we need to have a couple prep calls. And okay, who's in your what we call them natural supports? Who's in your care network? We had a former Secretary of Health who says that folks really need to kind of own their own care, own their own health, and own their own care. So we work a lot with our participants about, okay, who are your natural supports in your networks? And if not, how can we supplement those sorts of things? So, who's that neighbor or that grandkid or someone or a daughter or child can come and help you with that. So let's do a run through. Let's practice to kind of show you that, okay, you're used to using Facebook or whatever it might be. Here's how these platforms translate and operate there. And once our folks kind of went through it for a month or two, they actually found a real great uptake amongst our more senior population. And for them, for a lot of those individuals, our team member is really the only person that they talk to. And so to have that interaction, normally our business is kind of set up with that population where we're doing a phone call, just a traditional phone call monthly, and then once a quarter we would go out for a visit. And so we're thinking about a supplement where, okay, we'll still go out to the quarterly visit, but instead of making a phone call, we'll do a video call that allows us to lay eyes on the participant, show us around what's going on. Okay, you said you were eating, but kind of could see a weight loss or a weight gain, et cetera. So being able to put eyes on patients more frequently might be a positive side effect. I think to your general question, though, there's definitely going to be some folks that have fallen through the cracks. There's definitely folks that have delayed care because they've been afraid of contracting COVID, rightfully so. It's been, clearly very deadly across our country there. So we worry about the domino effect of that. And then again, that equity piece there, who's been left behind, who perhaps has lost their job but doesn't understand how to utilize and get on Medicaid or utilize those services, how they have access to preventative care and such. So there's always that patient education piece there. And what we're always thinking about is who's that trusted messenger for that targeted population there, and how can they deliver that to them? If I don't look like you, I don't sound like you, perhaps you aren't going to take your health advice from someone like me. Maybe I'm not your best messenger. So trying to pair those two things together to encourage people to utilize the care they're entitled to.